$1 trillion. Could you imagine how trillions of dollars could possibly impact our communities? Some say well over $3 trillion have been spent on the war on drugs. What has been the impact? Are we winning? Or rather, what have we lost and continue to lose? Because of decades of misinformation, the war on drugs started by the Reagan administration, you and many other Americans currently think of acid, magic mushrooms, and MDMA as dangerous substances that eat out your brain, or like Far Out Man, they're hippie party drugs. However, the purpose of this presentation is to persuade your view of LSD, psilocybin, MDMA from harmful party drugs to alternative medicine worthy of more research funds. My name is Ashley Luna, and today we'll be discussing medicine that has the potential to change the way we explore treating mental health illnesses such as PTSD, depression, anxiety, OCD, addiction, and many other diagnoses with significantly reduced symptoms that or either vanish altogether. Can you imagine a world where there is less loneliness, less thoughts of suicide, more empathy, deeper connection to self, nature, and each other? After we define psychedelics and review their history, we will touch on three main topics to help you understand why the time is now to support overall exploration and therapeutic alternative medicine. If you're wondering why the time is now, great. I ask you to lean in and listen with an open mind. As I touch on the impact of government regulations, the lack of treatment options, and that has fueled a mental health and wellness crisis. Yes, 40 to 60% of Americans not responding to current psychiatric treatment options is a crisis that we need to overcome. First, we will dispel any misinformation that we may have heard or come to believe as a result of the war on drugs. Then we will explore the effects of psychedelics and how they could be used therapeutically as alternative medicine. Finally, we will review scientific evidence that has not only doctors and pushing for deregulation, but also Stanford's professors, philanthropists, and soon to be you excited about the future of psychedelics and the well-being of humanity. What does psychedelic even mean? Well, the term psychedelic is derived from the Greek words psyche, meaning soul or mind, and the other term meaning delune, meaning to manifest. Hence the term mind manifesting. It was first coined by British psychiatrist Humphrey Osmond. And I find that term rather fitting given the many accounts of Dr. Timothy Leary traveling to Mexico in search of mystical experiences that gave way to higher levels of consciousness. After such trips, he claimed to have supernatural problem-solving abilities and to have endless creativity. Is also noted to be profound byproducts of ingesting these plant medicines. Early users of these so-called drugs were not burdens of society, but rather educated pioneers looking to heal the world. The Controlled Substance Act of 1970 officially began the war on drugs that not only shut down clinical trials, but also buried decades of scientific research and even ended ancient healing practices. Propaganda soon popped up depicting brain filled with holes after a single use of psychedelics was definitely a sure way to control the narrative. However, a letter came out that those government-funded research that put up the publication was actually a altered picture depicting a photo of a brain on methamphetamine. Government regulations also controlled all substances, including plants, that led to the production of LSD. LSD is one of the first psychedelic drugs commonly used by early doctors and psychiatrists. LSD was actually synthesized to simulate a mushroom trip, which is now semi-synthetic, meaning that it's made both from a natural substance, a substance found naturally, mixed with man-made substances. That natural substance being a fungus found on rye. LSD stimulates serotonin production and receptors, causing you to feel immense feelings of immense causing immense, profound feelings of altered perceptions of thought patterns, vision, enhanced hearing. And acid was originally introduced and commercially produced as medication in 1948. By the 1950s, clinical trials were underway with astounding success in its effectiveness in treating alcoholism, anxiety, and depression. Speaking of fungus that grows naturally, let's discuss psilocybin. A compound found in over 100 mushrooms, amongst the most famous Amanita muscaria. The fungi you probably come to recognize on Super Mario Brothers as having a bright white red cap has been used since prehistoric times. Psilocybin mushrooms at any dose produce feelings of empathy, euphoria, and altered thinking. Users also report that altered states last up to several hours. However, their experience can be remembered for the rest of their lives. Paul Statements reports that a single heroic dose of psilocybin, which is equal to 5 to 7 grams of mushrooms, has such a profound experience on his life that there is no other need for a heroic dose. Psilocybin is now available, or psilocybin therapy clinics are now available in Colorado, where plants have been decriminalized. Now let's discuss MDMA, a completely synthetic substance discovered by biochemist Alexander Shulgin, who was attempting to create a blood clotting agent. MDMA-assisted therapy shows the most promise to get approved by the FDA, designated as MDMA-assisted therapy for veterans suffering from PTSD as breakthrough therapy. Multidisciplinary Association for Psychedelic Studies, also known as MAPS, has phase 3 clinical research of MDMA-assisted therapy that demonstrates statistically significant improvement. What's statistically significant improvement? Up to, or 67% of the MDMA treated group no longer met the diagnostic criteria for PTSD versus the little to no improvement on the placebo group, while no drug designed by Big Pharma has such statistics. Misunderstanding, corporate greed, and uneducated opinions led many Americans like Timothy Leary to search for knowledge of plant medicine and ancient practices amongst indigenous people of Oaxaca. These substances later went underground, where they were synthetically produced and altered to produce those trips known as LSD. Rather than to allow government regulation to limit who gets what treatment and at what cost, let's change the course of history by making intelligent decisions that deregulate plant medicines and fund more research into psychedelics. Let's end Big Pharma's rule and make headway in Americans' mental health and wellness crisis by investing as little to $1 to research. We may not have trillions of dollars, but we have $1 guaranteed loose and change in your couch that can fund alternative research that results in alternative research in therapeutic medicine. So go to www.delmed.uttexas.edu to spend your money wisely and change America.